the National Rural Health Conference, and I've got here Mike Riley. Welcome.
Welcome. Sure.
So you've come from New Zealand Defence Force.
Yes.
Yeah. Can you tell me a bit about your background?
Well, I've been a serving medical officer in the Defence Force since 1999. And in the period before that, before I went to medical school, I was in the Royal New Zealand Air Force. And I worked as a storeman before I went to university for 4 years, and so I've been in the military on and off since 1989. But I've been a serving military medical officer since, so it's close to 20 years. And my role now is as the Principal Medical Officer for the Joint Operational Health Group, which is the tri-service operational group providing medical care to the Defence Force. So it's virtually all of the doctors and nurses, medics, etc. within the Defence Force.
It's certainly a unique way to come out of medical school and get out that pathway.
No, but it's it's very hard to once you join the military, sometimes it becomes part of your life, and it certainly becomes part of mine.
Yeah. Cool. Okay, well, let's talk about them. What New Zealand Defence Force? What are they?
So the New Zealand Defence Force is approximately 15,000 people in the New Zealand Defence Force in total, and that's including reserve personnel, which is about 12,000 regular force personnel. It's divided into three services: the New Zealand Army, the Royal New Zealand Navy, and the Royal New Zealand Air Force. The largest of the services is the New Zealand Army. It's about 6,500 people. And that provides an infantry brigade to the Ministry of Defence and to the government for deployment, and all the supporting arms that go along with that. The New Zealand Air Force is the next in size. That's about 2,500 people, and that's obviously got a transport role. So they're flying the C-130 Hercules and the NH-90 helicopters, what you see more and more around the country. And then the Navy, which is around about 2,000 people, which has 2 frigates, a multi-role vessel, inshore and offshore patrol vessels, providing both support to the NZDF as well as maritime protection around New Zealand. So, relatively speaking, it's one of the largest employers in New Zealand, but relative to our allies, it's very small. There's a barracks in Hawaii that houses more people than we have in our entire Defence Force.
I was recently there.
It's huge.
Yeah, it was quite interesting.
Yeah.
So it sounds like there's lots of different groups, and also professional groups within those, and particularly Defence Health.
Yeah.
Can you tell me a bit more about that?
So Defence Health, so the Joint Operational Health Group, which is the unit that I'm part of, has all of the medical assets for the New Zealand, virtually all of the assets for the New Zealand Defence Force. And it's made up of Air Force, Navy and Army personnel, and is all sort of working in the same to deliver the same output, really. So our aim is to provide support to the Defence Force in order for them to perform their missions overseas and at home. We have, it's the largest unit in Defence, largest single unit in Defence. It's about 600 or 700 people. And that's made up of medical officers, both civilian and military, nursing officers, again civilian and military medics, who are a hybrid, if you like, between a primary care provider, an ambulance officer. They're a specialty which is peculiar to the Defence Force. And all the other allied trades that you'd expect alongside that, so radiographers, pharmacists, social workers, everybody that you'd expect. Yeah, very varied. And it's so we are all on the one unit to deliver this care. So.
Sounds like it's a very evolving role as well.
Certainly. And so the Joint Operational Health Group didn't actually started only in 2015, the beginning of 2015. We brought all of the services, medical assets together into one unit.
Really?
So it brought us all together, so that rather than sort of having 3 small pieces to deliver from, we actually put all our resources together to create something that's more effective. And it's been a process over the last couple of years to develop the processes which allow us to work as a single unit, bringing the stuff from single services into a tri-service unit. So, but it's been an interesting time, and there's challenges that come with trying to pull 3 sets of traditions together into one unit.
Yeah. It would be very challenging in itself alone, just having three many different
it is, but it's a really, it's a very dynamic and a very young workforce, and so and we, for that reason, it makes the challenges in some ways more worthwhile, because you've got a workforce that is able to change, you've got a workforce that is willing to change, and you've got you can see the product of that change as they grow. It's been a really good time and good job. So.
Fantastic. I was wondering about how does this all fit into your humanitarian aid that you guys do?
So, one of the things that one of the prime requirements of the New Zealand Defence Force is for us to provide emergency care to both the New Zealand Defence Force and as a whole of government response to support humanitarian aid. We bring the same tactics and procedures and ways of doing business that we use on the battlefield into humanitarian aid, which sounds a bit unusual, but the things that we share, that are shared between disaster relief and a battlefield, is the chaos that comes along with that environment. So you've got a breakdown of infrastructure, you've got poor communication, you've got limited resources, you've got multiple casualties, all of which these things in a natural disaster are all things that we expect to see on a battlefield as well. So in some ways, the Defence Force is prepared better than most other agencies to deal with it. So we take our medical resources, including and up to a surgical team, into a humanitarian environment, humanitarian aid environment, and we can provide care and support both to the force, the NZDF, but also, if required to, by the New Zealand government, to provide support to the civil power, to provide health support to the population. And it depends on what mission we've been sent to and what resources the host country or the area has available to them. So if they have no surgical capability and they require one, we can put one in place. The best example of that is probably in Banda Aceh in 2004, I think it was, Banda Aceh, the tsunami, where the complete obliteration of the infrastructure meant there was no medical assistance available at all. And we deployed a surgical team to that environment for an extended period, providing support to that very damaged population. And at the other end of the scale, where we've got support to Fiji, which had, after the cyclone, where there were still, this infrastructure was in place but damaged, and they were still able to provide support within their own health infrastructure, or rather than replacing it, we could reinforce it. And we could the primary role in that case was providing support to the force so that we could do the engineering tasks and other things that are required to rebuild the country.
Sounds like you need to be very flexible and very innovative in your role.
You do, and I think the situations we're placed into clinically and environmentally demand that you've got a degree of psychological flexibility, and that you've got that you're adaptable to circumstance, and that you have that you're resilient enough to manage all of that and still remain a good team member. Because all of our care is built around teams and about the team dynamics, and so you need to bring all that stuff together to make it into a functional team.
Thank you so much for coming along and having a chat.
Thank you very much for having me. I really appreciate it.
That's been very interesting.
Thank you.